Welcome to our training session on body systems and functions. Nervous system. Regulates body functions, processes sensory input, controls voluntary and involuntary actions, and supports cognition and emotions. The brain interprets and coordinates responses, the spinal cord transmits signals, and nerves manage movement, sensation, and autonomic functions. The sympathetic system triggers fight or flight, while the parasympathetic system promotes rest and recovery. Key functions: sensory input. Detects environmental stimuli. Integration, processes and interprets information. Motor output, controls movement and secretion. Homeostasis, maintains internal balance. Cognitive development, supports learning. Memory and behavior. Developmental considerations. The brain grows rapidly in infancy, reaching 80% of adult size by age 2. Reflexes fade as motor and sensory functions improve. Infants are more sensitive to temperature changes and prone to head injuries. Cognitive and emotional development continues through childhood and adolescence, influencing behavior and decision-making. Musculoskeletal system. The musculoskeletal system provides structure, movement, and organ protection. It includes bones, muscles, cartilage, tendons, ligaments, and joints, all undergoing significant growth. Bone growth occurs through lengthening and density increase, with growth plates playing a crucial role. Bones protect organs, store minerals, and house bone marrow for blood cell production. Muscle mass and strength increase with growth, influenced by activity and hormones. Regular activity enhances bone density, muscle strength, coordination, and fitness. Running, jumping, and sports stimulate bone remodeling and muscle growth. Developmental considerations. Infants have limited muscle tone and coordination, needing support. Bones are softer and more flexible until puberty, making them prone to bending or fractures. Flexibility can cause internal injuries without visible fractures. Growth plates and long bones are vulnerable and need specialized care if injured. Babies have more bones than adults, some of which fuse as they grow. Respiratory system. The respiratory system delivers oxygen and removes carbon dioxide. Air enters through the nose or mouth, passing through the throat into the windpipe, which splits into bronchi leading to the lungs. Inside the lungs, bronchi branch into bronchioles ending in alveoli, where gas exchange occurs. The diaphragm helps regulate breathing by changing chest cavity volume. Developmental considerations. Children have narrower airways, increasing the risk of blockages. Infants primarily breathe through the nose and have higher respiratory rates. By 35 weeks gestation, most babies produce surfactant to keep air sacs open. Premature infants may lack it, causing breathing difficulties. Cardiovascular system. The cardiovascular system circulates blood, delivering oxygen and nutrients while removing waste, regulates body temperature, and transports hormones to maintain bodily functions. The heart, with 4 chambers, pumps blood to the lungs for oxygenation and then to the body. Arteries transport oxygen-rich blood away, veins return oxygen-poor blood, and capillaries enable nutrient exchange. Developmental considerations. Children lose fluids quickly due to higher surface area. Depend on heart rate increases for cardiac output. Small blood loss affects circulation significantly. Higher oxygen demand increases cardiovascular risk. Small veins and thick tissue make vascular access difficult. Digestive system. The digestive system in children breaks down food into nutrients for growth, energy, and health. Digestion begins in the mouth, where teeth and saliva start breaking down food. The esophagus moves food to the stomach, where gastric juices turn it into chyme. The small intestine absorbs nutrients with help from bile and enzymes from the liver, gallbladder, and pancreas. The large intestine absorbs water and electrolytes, compacting waste into stool, which is stored in the back passage until elimination. Digestive system. Developmental considerations in children. Increased glucose demand but limited glycogen stores make children prone to hypoglycemia and fatigue. Dependence on caregivers for hydration and nutrition is crucial, especially during illness. Higher metabolic rates lead to more waste production and greater fluid/nutritional needs. The pediatric abdomen offers less organ protection, e.g., liver, spleen. A longer intestinal tract increases fluid loss. The lower esophageal sphincter is underdeveloped in infants, leading to regurgitation. Endocrine system. The endocrine system regulates growth, metabolism, mood, and development through hormone-producing glands. The hypothalamus controls the pituitary gland, which influences growth and metabolism. The thyroid supports metabolism, bone, and brain development, while the parathyroid maintains calcium balance. Adrenal glands produce stress response hormones and regulate blood pressure, and the pancreas controls blood sugar. Ovaries and testes produce sex hormones for puberty and reproduction. Proper endocrine function is crucial for normal growth, and imbalances can cause growth disorders, metabolic issues, or developmental delays. Immune system. The immune system defends against infections by identifying and eliminating harmful invaders. Innate immunity provides immediate, nonspecific protection through barriers, skin, mucous membranes, and immune cells, while adaptive immunity develops over time, using B and T cells to build immunological memory. Key functions: eliminates pathogens and prevents infections, builds immunological memory for faster future responses, regulates immune reactions to prevent allergies and autoimmune diseases. Developmental considerations: newborns rely on maternal antibodies due to an immature immune system. Immunity strengthens with exposure to pathogens and vaccines. Supported by proper nutrition, hygiene, and timely vaccinations. Vaccination chart for Georgia. Renal and urinary system. Filters waste, regulates fluids, and maintains electrolyte balance. The kidneys remove toxins, regulate blood pressure, and produce hormones for red blood cell formation and bone health. Ureters transport urine to the bladder for storage until excretion. Key functions: waste removal, filters and excretes toxins as urine. Fluid and electrolyte balance, maintains sodium and potassium levels. Blood pressure regulation, adjusts blood volume via renin. Red blood cell production. Produces erythropoietin. Bone health, activates vitamin D for calcium absorption. Developmental considerations: children lose fluids quickly and require more hydration. Immature kidneys increase the risk of infections and imbalances, making hydration, hygiene, and medical checkups essential. Integumentary system. The integumentary system, skin, hair, nails, and glands, acts as the body's primary barrier against environmental factors. Key functions: protection, shields against pathogens, chemicals, trauma, water loss, and UV radiation. Temperature regulation, controls heat through vasodilation, vasoconstriction, and sweat production. Sensory reception, detects touch, pain, pressure, and temperature. Vitamin D synthesis. Produces vitamin D for calcium absorption. Excretion, removes waste through sweat. Developmental considerations: children's skin is thinner, increasing absorption of substances and dehydration risk. Their sweat glands are less active, affecting temperature regulation. Thank you for watching the Body Systems and Functions module. Please answer the questions for this training before moving on to the next training module.